praise, right? But now I'm going to invite someone who works without being paid. And that is Bhekisisa's board chair, Nic Dawes. Thank you, and good morning, Nic. Thank you.
Thank you, Bhekisisa. You know, I think you're joining Bhekisisa and having a leader of your caliber and a journalist of your caliber joining Bhekisisa and being here to host us today and lead these proceedings is, along with everything we saw in the video, a really important sign of how the organization is developing. And it gives me huge confidence for the future that you're part of this. I'm really very, very happy and proud to be here today, like I said. And it's not just to come back to Joburg and catch the smell of springtime dust and rain in the air or see the jacarandas from my window, although that's pretty good. My brief was to talk about the first 10 years of Bhekisisa and start to set the table a little bit for the next 10. And I was thinking about a few different ways of telling the story, and one of them is quite short. I could just ask if anyone in this room has ever tried to say no to Mia Malan. If you haven't, I mean, she's over there. Go ahead. Try. And the story, maybe in some ways, is the story of 10 years, 1,000 instances of people failing to say no to Mia Malan. Maybe pausing for a minute briefly and then realizing that she's right and they should shut up, the resistance is futile, and carry on. But of course, I didn't come all the way from New York City for such a short story. I think Mia would have asked for the airfare back. Also, not just for the jacarandas. I came, of course, because you asked me to, but also because I'm so convinced of the importance of Bhekisisa in the time that is to come. Not just proud of its record, but convinced that there's a model here that's deeply relevant, deeply necessary, and extremely powerful, not only for this region, but also globally, for the challenges that we face now. I think we need journalism organizations that are built like Bhekisisa, not just in Southern Africa, not just in the health space, but all around the world and across beats and across issues. And to explain what I mean by that, I hope you'll indulge me a little bit while I go back over some of the story of the first 10 years and start at this hinge in history that we find ourselves in right now. Because this is a moment of almost unfathomable peril and risk. On the one hand, the world is living with a kind of geopolitical long COVID, exhausted, suffering from deep fatigue, brain fog, persistent aches. Global institutions seem to be gridlocked or no longer fit for purpose. Illiberal populism is persisting maybe longer than many of us thought it would. And great power conflict is dramatically amplifying old risks and creating some new ones. The death toll in Gaza reached 10,000 yesterday, 4,000 of them children. And in the rubble of Khan Yunis and Gaza City are also the remains of any real hope for a binding international humanitarian law contract and for global cooperation. And as the bombs rain down, so the new records for temperature and extreme weather continue to get set. And the people in this room don't need me to remind you that we've got maybe 5 years to dramatically alter the trajectory of carbon emissions. We literally do not have time for this shit. And I can feel Mia and Bhekisisa are kind of glaring at me right now and reaching for their editor's pen to say, but Bhekisisa doesn't just call out problems, we also identify solutions. You need to move on. We have to look for evidence-based approaches that work. Enough already, and I promise I'm going to get there, but I want to go on for a little bit longer in this difficult vein. Because as you know, journalism has had its own long crisis, and it's paralleled and entwined with some of these other challenges that we face, including the crisis of institutions and the crisis of climate. And the easy way to talk about this is, well, the revenue model has been profoundly disrupted. Platforms ate all the advertising. Distribution works differently now. Subscriptions can work, but maybe only for the wealthiest and only for the news organizations that are winners in the space. And huge swathes of the audience are excluded. Public funding is scarce and politically pressured. And the people formerly known as the audience may no longer regard a press pass so much as a sign of trust as a kind of scarlet letter that should be shunned. And in South Africa, those challenges are just as stark as they are anywhere else in the world, if not more so. We have a public broadcasting system that's massively under pressure. We have a traditional press that is, in some cases, politically captured, in other cases, economically deeply strained. And we have a digital sector that is still whiter, older, and richer than the country is. And that means that for millions of people, TikTok or WhatsApp or the Sunday sermon is the primary source of news, whether it's reliable or not. And yet, and I did promise that I would come to this point, in this moment of polycrisis of climate, of economics, of inequality, of conflict, there's also possibility for the planet, for its people, for policy, and for public interest journalism. And I'm not saying that just so that I can line up as many P's as I can in one single sentence. So now I can go back to the beginning of the story. And I think I said in the video it was 2013. It was actually 2012, I think, that Mia first came to me. I was editor of the Mail and Guardian. I was pretty pleased with myself, as Hussein will confirm. Print circulation was growing against all the odds. We were a leading digital outlet nationally. We'd managed to grow both our investigative coverage and our coverage of other areas, partly by bringing in nonprofit funding and new approaches. And so imagine my surprise when one fine day Mia came and sat down in my office and said, in only slightly more polite language than this, "Nic, you are failing your readers and you are failing the country with your crappy health coverage. How can South Africa's leading serious newspaper be doing so little to address some of the most urgent public policy issues that the country faces?" And she didn't pause very long to let me absorb the blow. And frankly, I knew that she was right. I knew that the politics of HIV and AIDS had simply exhausted a lot of health reporting. I knew that most of what appeared in the mainstream media was a mix of wellness content and personal finance advice. And I also knew that we couldn't afford at the time to hire the kinds of reporters that we needed to cover the ongoing ARV rollout, to address the immense ongoing burden of TB, to tackle what was happening in hospital capacity and infrastructure, and to start to respond to issues of non-communicable diseases that the health minister was beginning to focus on at the time. And I'd even myself been, I think in 2004, to Manto Chabalala Msimang's first briefing on plans for a national health insurance. And I knew for sure, that was at the Vineyard Hotel, I knew for sure that we weren't ready to cover that issue in a way that didn't just repeat insurance industry talking points. Massively complex issue that we had no capacity to respond to. So I think Mia could probably see all of this flashing behind my eyes, and she very quickly said, "Don't worry, I've been on a fellowship and I have an idea." And the idea was Bhekisisa, and it really rested on three legs. Firstly, that we could frame coverage in a particular way and find a way into the issues that would give us a landing point. Secondly, that we could mobilize funding behind that idea. And thirdly, that there was talent out there whom we might not be aware of that could be fostered to deliver this coverage, and it needn't necessarily rest solely on hiring people who had been doing traditional coverage of the sector. So the first coverage idea was that a focus on the linked challenges of HIV and TB would go to the heart of the whole public health conversation, and that it would also activate reporting on a range of related issues. Secondly, that the money was there with donor funding that was already beginning to line up behind these twin challenges and that had already articulated a need to respond to them. And the talent, of course, was the pool of emerging young journalists who were just starting to come out of universities across the country and who were eager to find an opportunity to do serious work with great leadership. And, of course, underlying all those structural elements was a willingness to say, as a journalist, that journalism is a key part of the public health arsenal. And I know that might sound obvious to a lot of people in this room, and it feels very obvious post-COVID. But at the time, a lot of traditional journalists would have been a little bit uncomfortable with that articulation and might have said, well, we just report on the stuff that's happening. As Americans would say, we call the balls and the strikes, but not so much to see ourselves as a piece of the public health infrastructure. And I think that was at the core of the insight that Mia brought to me, and that we had to lean into that role if we were going to thrive and survive. And I'm pretty sure I said to her at some point, well, isn't this focus on TB and HIV going to be very restrictive? And are you really going to be able to engage readers around it and address the issues that matter most? And she looked at me in that way that she has, as if to say, don't you get it? If you tackle these issues, you have to tackle the whole system. And of course, that's exactly what happened. So Mia became our health editor and the founding director of Bhekisisa. We had support at that time from the German development agency GIZ. She hired her first 2 reporters, came up with a name, and I think we did some online polling about the name, which reinforced the choice of Bhekisisa. It stands the test of time. And Mia started attending the news conference where the tone of the paper was set. And in journalism, as in so much else, who you have at the table matters. So Mia had a big voice at the table, and the character of our coverage began to change. And we started to deliver groundbreaking reporting on circumcision. You saw some of that. On drug policy, on some of the wrangling over the NHI. And we started to deliver this mix of accountability reporting and solutions focus that has come to define Bhekisisa's approach. Support from the Gates Foundation, which has extraordinarily buttressed Bhekisisa's growth, has enabled it to develop into something much more expansive, of course, than it first was. And as you now know, Bhekisisa is kind of the health desk, not just for the Mail and Guardian, but for the whole country, serving 5 publications with a television show and a significant social media presence. Training reporters, working with policy experts on communication, and convening some of the most critical discussions around public health that are happening. And I think that this structure of acting as a convener of conversation, but also as a health desk for the country, is going to be crucial to Bhekisisa's next 10 years. I'll explain why. It's a truism, I think, and everyone in this room probably associates with the idea that when COVID-19 hit, the South African research community, policy community, and broader public health community was ready. And you were already, because of the experience of HIV and AIDS, clinically ready, ready from a research perspective, ready from a policy perspective, because of what you had already dealt with. Maybe less appreciated is that South African civil society had also had the experience of the previous pandemic, and the community of activists, and even the press had experience of this kind of situation. When a pandemic of misinformation blossomed into a really malignant kind of life in the first months of 2020, South Africans not only knew about how to sequence the virus, they also knew how to respond to misinformation coming from the top. It looked familiar. We had been led by practitioners of viral lies. Before there were tweets, there were Friday newsletters published on the internet. Before there was bleach and ivermectin, there was Viridine. So we knew about these things. And Mia understood that scaling up constructive journalism that could convey accurate information, support an informed public conversation, and drive accountability was the critical task. And she also knew that it couldn't be done by journalism standing in isolation. It needed to be done in conversation with the research community, with the policy community, and more, and this is part of the evolution of the organization, more and more with the audience. And so Bhekisisa's distributed model of publishing, sharing its work widely, not seeking to own it and hold it close, the rigor of its science-backed reporting, and anyone who has worked with Bhekisisa will know what the editing process there looks like, and know that it is not by magic that stories have the credibility and trust that Mia referred to in the video. That we could get good quality, reliable, accessible information into the hands of a hugely fragmented audience at the same time as convening more high-level discussion. Not doing that as insiders, but occupying this unique position that journalists of Bhekisisa's kind can in mediating the conversation in a trusted way. And it did that not as a huge institution, not as a public broadcaster, not as a university or a traditional newspaper, but as a small, agile, capable, expert collaborator, as a connecting node in a kind of resilient mesh of capability. And I think that's where the lessons for the coming challenges around climate really lie. You know, in our business, in journalism, there's a lot of pining for the good old days, when there were newspapers with hundreds of reporters, supposedly broad public trust, clarity of our purpose. But let me tell you, the good old days weren't always so good. There was a model of commercial and public media that lasted maybe 50 years after the Second World War. But it was ruled by the consensus view of people that looked like me, by white men, sometimes drunk, running an industrial set of processes to put out newspapers and broadcasts that represented the view, the consensus view of people like them. And a huge amount was left out. And in many ways, that model is responsible for bringing us to this moment of polycrisis. The failures of journalism around climate, the failures of journalism around health, and some of the challenges we face in public trust are deeply rooted in that institutional model. And when we think about climate resilience from an infrastructure perspective, one way we can think about it is building huge concrete walls to hold back the sea, or bigger air conditioning plants to cool down the places that we work. But we know that what really looks like being more successful is softer, more adaptable, more mobile forms of resilience. We need sand dunes on the beach that have vegetation growing on them to hold back the waves, not just big new harbors and barriers. And I think in the age of climate collapse and geopolitical fragmentation, we're going to face acute public health challenges. I'm not going to go into the details of that because there are vastly more expert people here than me to talk about the impacts of heat, to talk about flooding, drought, extreme weather, new diseases, the dimensions of gender that are implicated by extreme heat, the ways in which migration policy and refugee policy need to be adjusted, the ways in which research capacity needs to respond, and the critical importance of a journalism and a public conversation that is capable of imagining situations that we have never dealt with before and using evidence to fire that imagination and spark a better public conversation. And so I would no longer ask Mia if she would find a climate frame limiting. Quite clearly, if you address climate, you have to address the entire system. And if you don't address climate, almost nothing in public health can be credibly addressed. And to do that, we need institutions that don't have the character of old media institutions, that are not built around fortress-like private companies, that do not reflect only the views and expertise of one sector of the population, and that don't see the audience as someone to preach to rather than someone to engage with and support and help. And to me, that sounds a lot like an organization like Bhekisisa, with its not-for-profit funding model, with its emphasis on training and building a new cohort of reporters, with its deeply collaborative approach, and with its insistence on melding rigor and expertise with public engagement and outreach. All of that should sound very familiar to the South African public health community. And I think one of the extraordinary things about this organization and this community that's represented in so many ways in this room, and that has been so imaginatively supported by Bhekisisa's funders, particularly Gates, is that this model grown here in this place and in this way is what we need to begin to replicate, not just on the continent, but much more globally if we're going to get through the next 10 years. So I'm really looking forward to listening to the conversation this morning, to taking some of those lessons back to my own newsroom, where, by the way, we face profound challenges of climate and public health in a deeply unequal city, where, for example, a woman of color is 8 times more likely to die in a perinatal context than a white woman is, where flooding affects low-income communities and not the kinds of places where people like me live. And I think there are deep, deep lessons for what we're doing over there from the conversation that's going to happen in this room. So, Mia, thank you for coming and calling me out 10 years ago. And I'm looking forward to carrying on learning from you, Patiswa, the rest of the team for another 10. Thank you all.